Welcome back. Health4you is a mobile clinic equipped with necessary health practitioners who embark on outreach programs in communities. Health4you offers a variety of health-related services such as HIV rapid testing, counselling, just to name a few. For more details on this, I'm joined by Sister Maria Nuyoma from the Health4you Clinic. Sister Maria, good evening and thank you so much for joining us. Sister Maria, good evening.
Yes, good evening and thank you. Welcome.
Sister Maria, good evening. Can you hear us?
Yes.
Fantastic. Thank you so much for joining us this evening. Perhaps to start with, just give us a brief background about the Health4you Clinic.
Health4you Clinic is it's a clinic which was established by the late Mrs. Anshen Parkhouse in 1978 till 2010 when she passed on. I took over the clinic in 2011 where I fully implemented primary health care and occupational health services.
Now, you do community outreach programs, as I've mentioned earlier. Tell us about this.
I actually do primary healthcare services where I see patients, I examine them, and I provide them with treatment, and I do counseling. I also do pap smear, and I do family planning and immunization. The same time, I do provide also occupational health services, which is unique from other clinics, where you do test the employees of the companies on yearly basis or periodic or exit.
When it comes to managing follow-up treatments, how do you go about this?
Follow-up, when I do follow-up, we normally, patients come to us, we give them follow-up if they need to come back, and we give them what they need. But mostly, let me focus on mostly what we do. We actually have a mobile. The mobile go to companies to test the employees on occupational health services. Occupational health services has an act which is require each company to allow the employees to go through medical examination and to do various tests depend on what the person exposed to in the environment where he's working.
Mm-hmm. Sister Maria, talk to us about some of the frequent checkups that people should take into consideration as they get older.
As the people get older, you realize that your body starts giving up. So you need to come for checkup, medical checkup. You also have to allow your lungs to be tested, which we call lung function test. We also have hearing. Most of elderly people cannot hear. So it's better you come earlier, you do hearing test, and then you are provided with hearing aid. We also do vision test where we test their eyes so that they get vitamins and also refer to the optometrist to get glasses. What I also say important is for them to check their glucose, which is to identify whether you have a candidate of diabetes. We also do cholesterol test. When we detect earlier, you get the treatment, and also you get health education on what to eat and what not to eat. And of course, high blood pressure, which is more on elderly people, one need to do checkup because you come to know only when you check your blood pressure that you are a hypertension patient.
Talk to us about how the services that you offer to these communities have impacted the communities in which you operate.
I remember we provide primary health care, with which we see private patients, which are meaning cash patients who don't have medical aid. We also see medical aid patients, and we provide them with treatment. We do also family planning, and we do immunization. On occupational health services, we do lung function test, we do hearing test, we do vision test, we do cholesterol test, we detect area of any area disease which the person is, and we refer them to specialists.
Well, Sister Maria, that's all the time we have this evening. Perhaps some final remarks or words from you?
My final remarks on me, I want to talk about occupational health services, which is very rare in our country. It's only certain doctors who are conducting occupational health services, which I think even the youth should perceive to go and study the occupational health services. Occupational health services is where you go to the company, or the company come to the clinic, and you do medical checkup and do the tests which are needed based on the environment where the person is working. Because this you will not know if your company doesn't conduct it until you get retired. When the disease come up, you are already retired. So company like ShopRite, Checkers, Nampower, municipality, and others, they do conduct their medical checkup and occupational health services. But we have a lot of companies in Namibia which are not complying. They are not doing this, and they get their certificate at municipality. So I encourage the city of Windhoek to find out whether when the people register their company or re-register annually, they must ask them whether the employee have been checked, and they have provide medical papers from us so that they register the companies, because it will also help the public hospitals where it's full. If we upgrade and support the private clinic and doctors, we would not have overload on state clinic.
Thank you so much. Sister Maria, thank you for joining us this evening. Lovely speaking to you.
Thank you very much for inviting me.